Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Uses of calcium channel blockers. Okay, calcium channel blockers are used in low renin hypertension because in high renin hypertension, actually in high renin hypertension we have better drugs. Like in high renin hypertension we can use beta blockers are the drug of choice for high renin hypertension, whereas if the renin is normal, then in normal renin hypertension we can use ACE inhibitors are used in normal renin hypertension, whereas in low renin hypertension, the drug of choice is calcium channel blockers. The drug of choice for normal renin hypertension is angiotensin converting enzyme inhibitors. Then these can also be used in isolated systolic hypertension in elderly. These are actually the drug of choice for isolated systolic hypertension, where there is only systolic hypertension seen in elderly. Now, individual drugs and their uses. Amlodipine can be used in hypertension. Philodipine is available as an extended release preparation which is also used in hypertension. Then we have nimodipine. Nimodipine is it is cerebrovascular selective, and thus it can be used in vasospasm. After the subarachnoid hemorrhage we use nimodipine. Then we have ephonidipine. Ephonidipine is a new drug. It is a new drug which is used for atrial arrhythmias, is ephonidipine. Then we have nicardipine. Nicardipine is actually a cardioselective calcium channel blockers, and it is long acting drug. Then we have nitrendipine. Nitrendipine is actually a nitric oxide donor. Then we have dihydropyridines. These dihydropyridines are actually the peripherally acting calcium channel blockers, and they are used calcium channel blockers, and they are used in the treatment of hypertension. And in fact we can say, if you were asked what are the only calcium channel blockers used in hypertension treatment, the only calcium channel blockers used in hypertension treatment is dihydropyridines. Then one more thing, IV nicardipine is the drug which is it is the drug of choice for hypertensive emergencies. We can use this IV nicardipine.
thank you and thank you for watching.